Hello everyone, welcome back to my YouTube channel. Yes, it's me, it's Jane. I'm back. I didn't go anywhere. I'm back in full force. But first of all, how are you? How have you been? It's been months. Have you been taking care of yourself? And it's close to Christmas. Spot my earrings. Christmassy. So how are you doing? I hope you're all doing well. All right. Welcome back, and if you're new, this is Overseas Nursing Bands and my name is Jane, and what I do, I tell you all about being a UK registered nurse if you're trained abroad. So if you're a nurse that is trained abroad and you're planning to come to the UK to get registered and get your PIN, I have materials here, I discuss about it, things to help you on your journey to become a UK registered nurse, basically about the OSCE, even places, tell you about places and things that happens here in the UK, where to stay and all of that, and any questions that you might ask me. So let's get right into it. And oh, you can see TJ here. So we're going to do I've got loads of requests. So I'll take one at a time as I can, but please forgive me if I'm being so slow. Yeah. Anyway, before we go on, let's give a clap. We are 1,000 subscribers and we're monetized. So it means you're not going to be skipping the videos, the adverts rather. You have to watch the advert for your girl to make some pitching. All right, but I am so ever so grateful, really grateful for the support. Even when I haven't been posting, people have been asking questions, and I'm really grateful. Thank you ever so much. Thank you. So we're going to jump right into it today, and you're wondering what is TJ doing here. You know what he is doing. All right then, let's get into it. At this point, you will not be seeing my face. That is fine. I'm here. It's still me. Yeah. So what are we discussing today? We're going to be discussing removal of urinary catheter rock. So one of the skills during OSCE is the removal of urinary catheter. It's a very simple procedure. I've brought TJ to help me here. It's something you do anyway. It's something you're doing. It's something you're used to. As a nurse, even as a student, you're used to taking off catheter and everything. So it's a very easy procedure. You won't let your head dangle like that. You have to put your head up during OSCE. So pardon me. So we know the procedure. It is obviously when you're going in to start. You know the procedure when you're going to start. For all criteria, for all marking, for all OSCE skills, OSCE whatever, during your OSCE, these are the basic things that you do. You have to clean your hands with alcohol rub or wash your hand with soap. So your 7 steps, your 7 steps of WHO hand hygiene. You have to introduce yourself to the person. You have to check ID with the person. So the person's name, their date of birth or hospital number, and then you have to verbally check it against the wristband where appropriate and the paperwork. Okay. Also, you have to, very important, you have to gain consent. Definitely you have to gain consent of the individual, your patient. You have to sit or stand at an appropriate level and explain the reason for your assessment. You have to establish your reason for admission or visit, because it might sound silly, but when you're doing all of that as well, you're kind of doing assessments, your neurological assessment and all that. So it helps you. You have to measure your documents, and this basic, I think I'll do a 7-step that you must do during your OSCE. I have a video. I think I do have a video. I'll link the video. So I'm just going to start right now. So doing a removal of catheter, removal of urinary catheter. It's not a sterile procedure per se, but there are things that are supposed to be like it's a clean procedure. It's not a sterile procedure, but you must maintain maximum hygiene. Okay, so as you all know, you have to, I'm just having a make do here. So you have to have your, it depends on your center. Some centers, they give you a pack, or some centers they don't give you a pack. They just leave the catheter there and all that for you to do it. So depending on which center you're working with will tell you what to expect and what to do. So I have here with me, I have a bowl. So you might have a kidney dish, or this, I'm just improvising. So you might have a kidney dish, or so you have your gauze for, you know, to wipe before you. So 2 or 3 pieces of gauze. You have to have a syringe as well, obviously not an open one, a sterile syringe where you have to check the dates, check that it's not expired, you know, remember to do all that. Your wipes if needed, and your base, your tray. You have to don gloves, you have to don your apron. Where's my apron? That's my gloves. My apron is somewhere. So you have to don your apron. Obviously, anything you're going to do urinary, you have to put on an apron. It's very important. And then you walk to the patients. Hello, Mr. TJ. My name is Jane, and I'm the nurse taking care of you today. You obtain consent. I'm not going to go into all that. I'm just going to go straight into taking out the catheter. But we all know what to do in that aspect. I'm just going to do removal of catheter. So obviously, you know, you would have, okay, I'll just don my gloves for this part. I would have done my hand hygiene, 7 steps of hand hygiene, and then go to take my tray. So be watchful and know your center. If they have a pack already, if they have a pack, then that's easy. You just pick your pack and put in your tray, your kidney dish or whatever, and take it with you to the patient's bedside. If they don't have a pack already, if they don't, so you know that you pick your syringe, pick your gauze and your tray, and then an Inco sheet if necessary, which is necessary anyway, in case there's some spillage and all that. Okay, so what you go after you've done, I've taped this here, so you know it's inflated with 10 mils. Usually use 10 mils, and so I've just taped it here. So let's assume this is improvising. Let's assume this is inside the urethra. It could be female, it could be male. And then when you take your gauze, oh, I don't have, okay, so you take your gauze, you just wipe and discard, and then after you've gained consent from the patient, you now check how much fluid is how much urine in the leg bag. Take a note of that. Take a note of the color, if there are sediments or anything like that. Just take a note, just in case you might need to advise the patient. So this is where you go. Make sure this tip is sterile, usually, that is going to go in here. So you're taking a brand new syringe, not an open one. Open it, and then what you do, you go there, and then you will draw. You're supposed to get 10 mils, but you know, when the catheter has been in for a long time, it's not possible. So that's why I didn't put exactly 10 mils in there. But you'd have checked I don't know, I bought this on Amazon when I was, so you'd have checked and said, oh, it's 10 mils that is supposed to be there, and then you withdraw, and then you can tell your assessor how much you have withdrawn. You might not necessarily, you might get about 7 mils. It's not necessary. In fact, most times I haven't withdrawn any. I'll be honest with you. I've done catheters loads of time. I haven't been able to withdraw exactly 10 mils. it ranges between 7 to 9 mils after they've had it for maybe 3 months, depending on how long your patient has had their catheter. It could be 10 months, sorry, not 10 months, pardon me. It could be 10 weeks or anything like that. So you definitely are not going to get 10 mils. And then you indicate, you put it in your kidney dish, and then you tell the patient, and can you give a little cough while I bring this out? So, and out. Obviously, you have your bin bag and everything like that, and then you put it in your bin, discard them, and you just explain to the patient what you're going to say to the patient is to encourage them to drink, to exercise, drink 2 to 2.5 liters of water, to move around. Obviously, if they're retaining, they have to call you back, but drink a lot, exercise, move around and all that. And then you clean your hands or wash your hands after you've taken off everything. And so that's the main thing. But other processes, you know it already. I have a video like that. You can, what to do when you walk into the patient's room, what you do after that, and all of those. I just wanted to show you quickly how to remove. That is as simple as that. So this is how it's, I think that's the same catheter everywhere anyway. So this is where you put your syringe in and draw up. So it's there. So you can see it's a V-shaped, two and there. So it's not here. This is where your leg bag is attached to. So this is the where you put in and withdraw. It could be green, it could be blue, it could be whatever color it is. It doesn't matter, but just know it's the other one. Not this one is where you'll attach your leg bag. Okay. All right then. So I hope that has been a bit helpful. No, it's a short video, but it was a quick one just to show because somebody had requested for this, and I'm so sorry for whosoever. I hope you passed your OSCE anyway. But for those that are coming ahead, this is how you do your. It's a very straightforward procedure. Remember, you do all the processes. You don your aprons. You ask assessor, has the tray been cleaned, or you know, all of those things you do. I'm just showing you the just simplified basic to remember this step here, that you wipe and then you put an Inco sheet if there's an Inco sheet, and there's possibility you might get a pack. So in the pack there's everything, but if you do not get a pack, you put 3 pieces of gauze, your Inco sheet, your syringe, which everything you check that they are in date. You make sure they are in date, they've not expired, and they are intact. When you've done all of those, you take your tray to the bedside, inform, gain consent, and it's important after you have finished removing it, you have to advise your patient, here now Mr. TJ, advise your patient to make sure that they drink 2 to 2.5 liters of water, that they exercise, okay, is very important, and any other generally being nice to them. All right, I hope you've enjoyed this video, and I hope to try, I'm going to really try to keep up now, get into the swing of things, you know. And thank you again for your support. Please, if you've enjoyed this video, and I'll appreciate it if you will subscribe to me, and if you subscribe and share and make your comments and keep asking me questions and make requests. Even I don't come to it, I will definitely come to every request. All right, thank you, and I appreciate you so very much. Happy Christmas, everyone. Bye.